KSLA presents Your Hometown Show, featuring outstanding businesses and services in your community.
Good morning and welcome to Your Hometown Show. I'm Stephanie Boswell. This morning we have Trinity Home Health Care with us, and joining us to talk a little bit about Trinity Home Health is Ashley Dowdy. She is a PR specialist. We also have Lisa Jenkins, who is a transition nurse. Both of y'all, thank you for being here this morning.
Thank you for having us.
Ashley, why don't we just first of all have you tell us a little bit about Trinity Home Health, the history of it.
Trinity Home Health Care is individually owned by Janie Jones. We are coming up on our 6-year anniversary. We have 3 locations in Shreveport, Minden, and Coshado. Danny also owns our sister company in Northeast Louisiana, which has grown to 9 locations in more than 20 years. So there's a lot of experience behind Trinity Home Health Care and our sister company. Our hardest to serve is our motto, and that's because we treat our patients like their family and with the utmost compassion. One of the reasons why Danny started home health is home health afforded him the opportunity to have his grandfather live with his family, and those lasting memories that he created with his grandfather drove him to open his own home health company. And so he wants families to have that same opportunity to be able to spend time with family members in the comfort of their own home.
And it's really important to pick someone that you trust, to have someone that is helping your family member. Lisa, first of all, tell me what a transition nurse does, and then who would benefit? What are the types of patients that would benefit from Trinity?
Okay, a transition nurse really assists the social workers and case managers in the hospital in actually transitioning the patient to their home.
Right.
It may not be just a hospital, it may be a skilled nursing facility, it may be a long-term care hospital, but I actually go in and visit with the patient. We find out what equipment they need. We might even go over some education as far as their medications, but really to actually transition that patient to home is what we do.
In my first thought, when you're thinking about somebody coming into the home, it's got to be expensive. What is the cost for something like this, Ashley, and how do you know if you're eligible for Medicare?
Usually nothing. Currently, Medicare does not have a co-payment, and as long as your doctor feels that you need home health and you meet certain criteria, then home health will cover therapy in the home, occupational speech therapy, and physical therapy. It'll also cover skilled nursing, and it will cover medical social worker to come to your house as well. To find out if you're eligible, a doctor has to say that you are eligible and refer you to home health. But Medicare guidelines require you to be homebound, and that's not bedbound. Those
right.
are 2 separate things. To be homebound means you can leave the home for infrequent short visits or short durations of time, but it requires a taxing effort. Maybe you need help from someone else, or you need an assistive device like a cane, a walker, or a wheelchair. Mm-hmm. You can still go to church, you can go to your hair appointments, you can go to your doctor visits, but as long as those trips away from home are infrequent and a short duration of time, and you will be considered eligible, and Medicare will cover 100%. We also take private insurance as well.
Okay. And now this is not like a home sitter. This home health. Tell me kind of a little bit different. What's the difference?
Sure. Home health actually requires a therapy. Like Ashley was saying, nursing, physical therapy, occupational therapy, or speech therapy. A sitter would be a private pay situation where a family may say they need somebody to come in and actually sit with their loved one so they can go to work. They might cook for them, they might pick up around the house, but that's not something that that we at Trinity do just because it's not covered by Medicare.
Okay.
And we can refer them to a sitter service, and someone can have a sitter service and they can have home health.
Right.
But they are 2 separate things.
So why Trinity? What makes Trinity different than other home health care services in our area?
For us, our patients are like family. We're on call 24 hours a day, 7 days a week. We have a pediatric nurse on call, a geriatric nurse on call, and a psychiatric nurse on call. You can call us any time of the night. We'll answer the phone, and if a nurse needs to come out, then they'll come out to your home.
That's important. Yeah.
That is very important. Also, our mission statement is our hardest to serve with dedicated professionals, achieving a better quality of life for you and your family, and we have strong convictions about that. We do a lot of community outreach. We go visit our pediatric patients. We have a Santa Claus and an elf. Many of our pediatric patients are homebound. They cannot leave the house to go to the mall and see Santa Claus. Some of them don't even go to school. Some of them are very, very sick. So to see Santa Claus come in their house and personally give them a present is just a humbling experience.
If someone needs more information or wants more information, where do they need to go, Ashley?
They need to go to their doctor. Contact their doctor if they feel they need home health, or facilities if you're in the hospital, or if you're a caregiver and you have a loved one in the hospital. Facilities can also refer a patient to home health. Once that doctor refers a patient, we will check their insurance, and we will send an admit nurse to their house to begin the process, or if you're in a facility, we will send a transition nurse to your room to begin the process.
Okay, and if you could give us, where do we need to go to get more information?
You can go to our website at www.trinityhomehealthcare.net. You can call our 1-800 number at 888-371-9989, or locally 861-0306, and that's here in Shreveport.
Okay, Ashley and Lisa, thank you so much for being here. And for more information, go to ksla.com, Focus on Health. This has been your Hometown Show. I'm Stephanie Boswell. Have a great day.